your time at the conference. And I'm Demetria, and I'm presenting with Oriomi, as Liliana said, and we'll be discussing CoVHORT CATS, which is a community engagement study that we have going at the College of Public Health at the University of Arizona, which is designed to strongly incorporate youth into our research and into our study design. And then we're also going to explain the adult component, which is CoVHORT. All right, so I'll start with the general layout of what our presentation will cover so you kind of get the flow of it. And it'll be in 3 sections. First, we'll discuss the importance of young people in community engagement and best practices for community-based research. And then after your brains have warmed up, we're gonna ask you to participate with us, and we'll share experiences with community-based participatory research, and we'll discuss some do's and don'ts in community engagement. And then finally, we'll work together to develop a community engagement plan for youth-focused COVID-19 research. All right, so let's get started with the importance of youth engagement. And then again, for this section, we will give a brief background of CoVHORT CATS. We'll discuss the importance of young people in engagement, and then we'll also share some strategies with you to increase youth participation that you can hopefully take back to your organizations and the projects that you have going on there. All right, so we'll start off with what is CoVHORT CATS. So CoVHORT CATS stands for COVID-19 Cohort Children and Teen Study. And so you'll see the COVHORT bolded. It's a COVID cohort study. And then the CATS stands for the children and teens. And so for CoVHORT CATS, our primary objective is to understand direct and indirect impacts of COVID-19 on young people by integrating action-based research and youth engagement. And then for our study design, we've designed this as a longitudinal 5-year study, and we've developed surveys for youth to take online in an online format. And the study is for children and teens aged 12 to 17 years. And so for the design of the study, it starts off in year 1 with enrollment. And then there are 3 surveys that participants take in the first year. So just note that the enrollment phase includes a consent form that parents fill out and an assent form that the child fills out. And we've added this into the study so that all parties, the parent and the child, understand what the study is about, what their involvement will entail, and then what we want to get out of this study. In the first year, we have a baseline survey, and then there will be 2 follow-up surveys. And then following that, the survey burden gets a lot less as the study goes on. In years 2 through 5, we ask that youth only take 1 survey per year. And so those are follow-up surveys from the initial survey. Now going on, I want to discuss our measures a little bit that we're using to kind of pull information from the survey. And we would like to assess emotions and worries, strengths and support, school experience, housing and food security, social climate, and intersections. And so all of these measures, we created our survey with validated scales that center around resilience and the social determinants of health. We really wanted to make sure that our surveys are pulling this information effectively so that we can truly get a really great understanding of what's going on with young people and the stressors surrounding the pandemic. Now, what does it mean to incorporate youth in community engagement? This graphic was pulled from a UNICEF framework for adolescent involvement. It's from 2018, and it basically highlights all the key components of what you're doing for the youth, what you're giving back to them. And so in our study, we're wanting to provide youth with a platform, which is really, really important anytime you're involving youth in research or in a study. We want to allow them to express their views and be able to express their views freely. We also, if we're giving the youth a space to have a voice, they need an audience. They need someone who's going to talk to and who's going to hear them out. And so we aim to listen to the youth's views when they are presented. And then we also want to provide a safe space for youth to be able to speak in. We want them to feel comfortable, like they can be themselves and like they will genuinely be heard. And then finally, influence. We want to use our influence to act on the youth's views as appropriate, and then also encourage them to use their influence to act on those views. In general, CoVHORT CATS really wants to use this approach to include youth in our study as active stakeholders. Now, why is it important to engage youth in research? Engaging youth empowers and helps build resilience by allowing them to understand and exercise their abilities to strengthen their communities during difficult times, for example, the current pandemic. And this is another graphic from the UNICEF framework. And this is something that we're hoping is a solid give back for youth. We want to empower youth and kind of give them the attitude that I can do this, I make a difference in my community, my actions and my words matter. So we want to empower youth in 3 ways. We want to empower them within, which can help improve feelings of self-efficacy, self-confidence, help improve thoughts of dignity, self-worth, recognition. And then we also want to empower the communities with our youth through collaborations, solidarity, and some of their strengths and their experiences. And then we also want to empower youth to influence decisions affecting other youth like themselves, empower them to lead, and empower them to inform and promote positive change. Diversity is having a seat at the table, inclusion is having a voice, and belonging is having that voice be heard. This is a quote that we've included because CATS, we really want to drive home the idea of diversity and inclusion. And our study really is centralized around those 2 ideas. And some key takeaways are that we really recognize the importance of diversity. And I just wanted to share a few things from the literature that we had. And so we really value diversity. And here are some reasons why. Children of color are disproportionately exposed to uncontrollable stressors. Intergenerational trauma, loss of language and culture, and low socioeconomic status contribute to the significant challenges faced by Indigenous youth. And regarding sexual minorities and youth with disabilities, they're at heightened risk for experiencing stress, depression, and anxiety related to bullying, social isolation, and then also there are different impacts for people with different body differences or different gender preferences. Another driver for us is that we want youth to have a voice. By engaging young people in research, scholars can ensure that their study is relevant to the realities that face young people today. It's difficult for us as adults to speak on behalf of youth because we're not youth, we're not in their shoes, and we're not dealing with the issues that they deal with every single day. So their voices matter. And then we also want to integrate results into practice and policy generated from ideas from youth. And then finally, we want youth to have a sense of belonging. And we feel like involving youth is a meaningful way for them to connect with their communities. And then also youth engaged initiatives have been shown to lead to increased ownership and empowerment and nurture the leadership skills of youth. And now I wanted to share a really great study evaluation that was done. I think they did a really great job in engaging youth and showing the strengths of youth in a project. And so this final slide will show some strategies and tips relating to that. And this study was conducted in Canada, and it was on a program called Youth Can Impact. And the program provides care services with various interventions for youth who suffer from mental health issues or addiction disorders. And in the article, they notate the youth as youth with lived experiences, and they use that term so that they're not using a title that would add stigma to these youth that have these issues or these experiences. The aim of their project was to evaluate a community-based care team using a collaborative approach with youth serving agencies, researchers, youth on the team, and then caregivers. All of these were their primary stakeholders. And to engage a larger number of youth, and to ensure that many voices were heard, the approach they used was to have a small group of youth deeply engaged or highly engaged, and then they had a more broad range of youth engaged over time periodically. And in general, the youth contributed key ideas to their research and clinical aspects of this evaluation. And this helped them facilitate outcomes that were more relevant to youth of needs today and youth who have lived through these experiences. And some key strategies that they use to constructively engage the youth. These are things that you can take back. These are things that we can incorporate into our CATS project. But I'm going to go through a quick list. Decision making. opportunities with the youth. They ensured that the youth membership was diverse. They ensured that the youth working group had a strong youth facilitator to encourage idea sharing, to encourage participation, and to help the youth feel comfortable in the working group. They also encouraged youth to use their voices. They included target demographics for this issue in the engaging informative pieces of the project. For example, the youth working groups included youth with lived experiences as full members of the working group and some of the core decision makers. And then also, which I think this is a really great point, the youth were able to co-present with the research team in different conferences, and the youth were also included as co-authors on peer-reviewed articles that went into peer-reviewed journals. And the evaluation noted that youth will continue to be involved in the program longitudinally as they continue to make decisions for youth that impact youth. They want to make sure that they have that influence from youth who've also lived that. So I hope these are some useful strategies that I've explained from this study. I thought it was a really great one, and it's the youth engagement and the Youth Can Impact trial if you want to read more about it online. Now I will pass it over to Oriomi to review our case study.
All righty, thank you, Demetria. So for this segment, we will talk about do's and don'ts in community engagement. So first, we'll discuss a case study on immigrant youth. Then we'll share amongst ourselves our previous experiences with community engagement and research, particularly with youth participants. And then we'll also present a community engagement plan, which would complement a youth-focused COVID-19 research study. So I'm going to read this case study. You guys can also follow along as well. So this is our case study. It says a national-wide study conducted to assess the impact of COVID-19 among immigrant youth. 6 high schools within Chicago are recruited for participation. These schools in particular are located in the poorest neighborhoods of the city, where many undocumented immigrants' families reside. From December 2020 to June 2021, interviews were conducted with youth over video conference. All participants received a $50 gift certificate for produce after meeting the requirements of completing 2 virtual interviews and participating in a virtual health education program focused on mental health and nutrition. The virtual interviews and workshops were facilitated by the study researchers who reside in Boston, and 2 Chicago-based community health workers also provided support but had little input in the study's design or implementation. By the end of the data collection period, researchers observed that participation was low. However, among those who participated, nearly all said in the follow-up assessments that health education workshops were informative but not feasible. Additionally, almost all were shown to have high scores of anxiety and depression. So I'm hoping that we can get people talking now and to figure out what is wrong here. What are some things that you're seeing in the study that could be improved, or what are you, first let's start off, what are you guys are seeing that is wrong? We can't actually see you all, so any takers?
Yeah, feel free to jump in.
Feel free to jump in.
I think Liliana can see the chat, but we're not able to see the chat.
Yeah, I'm on the chat, so feel free to share your comments here on the chat. Okay, we have a comment that says the community health workers should have been involved from the beginning.
That's very true. That's very true.
Right, absolutely. So if you're working in a community and you have community health workers there who are working in the community every day with the population, they probably have the best cultural outlook, the best outlook on what's appropriate with this population. So that's a really great point. Thanks, Annie.
Thanks, Annie. Any other comments before we dive in and break this apart? Hello, I think Denise.
We heard someone come on.
Yeah.
Denise, did you have a comment?
Oh. Okay. Okay, so I guess what we can say that, what do we know? So we know that the study is being conducted in Chicago. However, it's being virtually
Oh my God, I
facilitated.
can barely hear them.
Denise, would you mind muting your audio, please?
Thank you. So we know that the study is being conducted in Chicago, but it's being facilitated from Boston. We know that, like Annie said, CH workers are not heavily involved in the program design or the implementation. We know that participation is low. We know that participants showed a low scores in anxiety and depression. And we also know that students received a gift card for produce after completing the interview and participating in the virtual health education workshops. What we don't know how the schools were recruited. We don't know if parents or teachers were included in the recruitment process. We don't even know the type of questions that were asked in the interview. And we don't know the study measures. We don't even know if the students had access to Wi-Fi to begin with. And that could have been the reason why the participation was low. And participation could have also been low because of due to lack of trust or familiarity with the researchers. And we don't even know if the students have access to fresh produce to begin with. So there's a lot of things wrong here. And does anyone have any comments of how it can be improved before we share our recommendations?
We know that several things that are like, oh, they probably could have did this a little better. So what are some things that are opposite to what we stated? Some really simple things that they could have shifted or done better.
There's no wrong answers, just feel free. Okay, well, so one of the things that we made is that involving community partners at the program's design and implementation. Sorry, keep going fast. All right, so involving our community partners in the program design and implementation, and then providing a more appropriate, culturally sensitive health education session that would empower youth as opposed to discouraging them due to their limitations. And then researchers could have also had an action-oriented research approach. And this research approach could have been more of a problem-solving context as opposed to just doing an assessment of something, right? So, and then also the researchers could have been more reflexive and embrace multiple perspectives in the program's designing phase. So that's pretty much what we think could have been improved. So I want to take a few minutes now for someone to share, 2 to 3 people to share their experiences, either positive or negative with community research or research community engagement with youth. Can anyone share a positive or negative experience?
And this can be professional, it can be, in the work environment, it can be like in, volunteer work at your church or in a community group. I know we've all worked with youth. We all, you have kids, you work with their friends. And so what are some experiences you've had in work or personal life?
Hey, everybody, this is Courtney. Can you hear me?
Yes, we can hear you.
Okay, fantastic. So I don't know that this is a clean example, but I'm always glad to learn from what didn't go well with me. So this is an example of something that was really well intentioned, but just wasn't well attended. So one of my passions is my career started with kids in care. And so one of my passions is always to connect back resources wherever I'm employed to those kiddos, because those kids in care do tend to be in silos. So they get resources and information from people who that's all they work in. And a lot of what we're trying to do in public health is bridge across and start looking at resources that can be shared. So those were my good intentions. And I worked with DCS to get into one of their young adult program. It's like a career center space that they have in the offices, to have a vaccine event that was closed So it had Johnson & Johnson, which that a couple of weeks was really well wanted and people were having a hard time accessing. We thought that we would be smart and make sure that every single kiddo was spoken to about it and informed, which we did. But what we didn't create was a feedback mechanism, because the case managers are, as everybody knows, really slammed. But we didn't have that feedback mechanism for them to feed back to the folks who were organizing it, myself, to say that, hey, actually, it's not a matter of the kids having access to it, is that we really need education and they don't want it in the first place. So by not building that in, you know, we dedicated a lot of resources and had a lot of good intentions, but we needed a way for those, pretty much for the young adults to be able to communicate directly with us rather than through, you know, 2 or 3 layers of adults.
Yeah, that's a really great point. Thanks for sharing that example. I think one thing there, and the work you're doing is great. I love that you take like a piece of every job that you have and kind of try to find a way to give that back to the youth around you and your community. I think one thing that we've talked about in this presentation that's always really good is to have youth on board. So, or even ask your kids, ask like nieces and nephews, ask, you know, the youth around you in community groups, how you feel about the vaccine, what you think about it, what do your friends think about it, and kind of put your feelers out there for what general youth around you are, how they feel about the vaccine or about any youth related topic, because how they feel is, it may be a good, it'll give you a good idea about how other people feel. They go to school with a bunch of other students who have similar ideas, I'm sure. So just having the youth and having an idea of what to expect from the youth, I think, is something that would have been really beneficial.
Thank you. Thank you again for that. Any other takers want to share their experience, either positive or negative, before we go into the engagement plan? Okay, so I actually wanted to take it a step back. So this study, this case study that we created was actually adapted from a study that I found on a youth empowerment program. And this study was not centered on COVID-19 research, but it analyzed a program called the Chicago's Youth Health Service Corps, which is established to help with addressing barriers to improve care, health literacy among undocumented communities. And this program has been replicated in over 30 states, and it was designed to help youth build capacity and to promote behavior change. Medical students from Rush University actually worked with local hospitals and providing weekly health education seminars and training. And after the students, or excuse me, the participants were trained, they would go back into the community and train and teach 10 other people, family members and friends. And I found this model to be very, very fascinating because it gave the youth, they were considered to be agents of change in their communities, right? And they also received college counseling, tutoring, leadership skills that were also developed. And they also had multiple opportunities to participate in lobbying, advocacy efforts in local, state, and national levels. And I think like for us, we're doing an action-oriented research. Not only do we want to understand what's going on with youth, we also want to give back. We want to do something to help them. So I think moving forward, I think and hoping more research will be not only just assessing things, but we can also learn from them and also give back and address the needs, address the things that they need in their communities. So we want you all to do a community engagement plan. It sounds so big, but it's not. We want you all to first take a few minutes. Hopefully, we have a link. Liliana can share it in a Google Doc. You guys can work on it. Just take a moment to consider a specific youth population within Arizona and think of 2 to 4 activities that will be part of an engagement plan, which would complement your COVID-19 research. So for those of you participating in Zoom, Liliana's put in the chat box, you can add your comments there. And I'm not sure if people are seeing it in person, you can possibly talk to someone next to you and work on that as well and discuss. So first you'll decide on the youth population. So preferably an ethical, racial, or sexual minority groups such as African American, Latino, LGBT, Indigenous, Native. And then second, decide a focus point for your research. And then also the organization that you're pursuing that is pursuing this research. So for example, I decided that my youth population is on LGBTQ youth, and my research topic is focused on assessing the impact of COVID-19 on LGBT youth with regards to homelessness. And this research is being conducted at the College of Public Health at the University of Arizona. And third, as part of your action-oriented research, provide at least one or two community engagement activities. So with the same example again, one activity for my research would include a safe space mobile application, which would help youth find immediate social services based on their location. This application would pair youth with university mentors, student mentors, and then another activity will be a focus group, which was created for LGBT youth to share their experiences and engage in meaningful conversations with the support of the Office of Inclusion and Diversity. Faculty, staff, and students and volunteers will offer networking opportunities for career and academic development. So that's an example. We're hoping that this is an interactive workshop, so we're hoping that you all can think of some ideas and hopefully talk about it in the next few minutes. So we'll give you some time and hopefully you all can present and discuss what you've came up with. All right, does anyone have any questions accessing the document? I see some people in here, but just to explain one more time. So in column 1, you'll put your name. In column 2, you put your youth group, that youth population that you're focusing on. And in column 3, you'll talk about the topic, preferably with regards to COVID-19 research. Column 4, you would put your organization, U of A, university, ASU, health department, etc. And then the activities that you plan for your action-oriented research engagement plan. Any questions at all? Hope that makes more sense. Okay, I see some. Okay, thank you, Annie, Andrea. We'll mute ourselves.
Actions, that's good. All right, so we'll give about another minute to wrap up thoughts, and then we'll kind of ask everyone to share if you're willing.
All righty. Can we have Annie and Andrea share, please? Adriana, I apologize, share.
Hi, this is Annie. Can you hear me?
Yes,
Yes,
we
we
can.
can. Thank you.
Awesome. So we're still kind of in the middle of thinking through it, but do you want me to just go through the different boxes?
Yeah.
Sure, please.
Okay. So we are thinking of having our research focus on low-income youth. And the topic would be assessing the impact of COVID on mental health of low-income middle schoolers. So we're with the Maricopa County Department of Public Health. And we got some inspiration from the example you provided about the app, because we were thinking middle schoolers don't really like to talk too much in person, probably, especially if it's all about sharing the feelings. And so the idea was to create a mobile app so that the youth could share their experiences somewhat more anonymously. And then our second idea was to, which we did not quite write down yet, was to have like a TikTok competition where youth could like put together their sounds and their, their different stories and stuff as a way to kind of represent responding to a prompt or whatever.
Wow. That's excellent.
That's a really great example. Thank you so much. And I love the TikTok piece. We actually, in our COVID cohort cats meetings, we joke about, we need to make a dance about cohort and cats and like let it take storm on TikTok, except none of us want to take on the mission of making up the dance and doing it first. But I absolutely love that idea. And I feel like one of the most engaging apps that youth are using right now. So that's a really great place to target youth. And then also with the mobile application, that's an amazing idea because you don't catch a kid without a cell phone in their hand. And apps can be shared on social media to go further and wider. You can even share the app on TikTok or incorporate it somehow. So those are really great examples.
Thank you. Thank you so much, Annie and Adriana. So we have another one. The group is from Equality Health. Would you be able to share?
Sure, that was me and Karina. We're still working on it, but let me go ahead and read it. So we decided for youth population, low income youth, since as part of our job, we do serve some of the underserved zip codes. And then for research topic, it would be, we would like to assess how many of those youth that were interacting with, how many of them have they received vaccine education from their primary care provider? And we're still thinking about some of the engagement activities.
Oh no, it's hard. When we're planning this out, like this is going to take some time. So it's hard. You have to be very thoughtful when you're planning engagement activities. So thank you all for brainstorming with us. This was a really interesting part of our presentation. So thank you for doing that. So we're going to move on now. And can you also, okay. All right, and talk about lessons learned, okay? So in this segment, we're going to discuss some best practices for community engagement and youth research, and then share our current study findings and future plans for community engagement. So can you also see my screen?
Yes, we see it.
Okay, so this model that I have here, it was developed in 2014 by the Center for Addiction and Mental Health, which is part of the McCain Center, which is a large urban hospital in Toronto, Canada. This model was developed through literature reviews on youth-adult partnerships and other forms of youth engagement and models on participatory research, and after several trials and errors with engaging youth people. This model is used as a conceptual framework to guide youth engagement strategies. It's shown here that by upholding core principles of flexibility, mentorship, and authentic decision-making and reciprocal learning, it can help maintain and retain youth engagement and increase youth participation. So the article provided several best practices for youth engagement, including developing partnerships with young people early in the planning process, being proactive and planning and developing guidelines for youth engagement, recognizing the need for training about youth-adult partnerships and co-creation, establishing a method of recruitment that speaks to the diversity of the individuals being solved, and also developing an understanding of the needs of the organization, the needs of the community, the needs of the project to guide engagement strategies. So we have used many of these components of this framework for our community engagement plan, which I'll talk about now. So we're currently in the beginning phase of developing our community engagement plan. And so far we've designed a three-pronged approach. So the first arm is education. So we're designing a STEM program, which will be to engage youth for future careers in public health and science. Youth will have the opportunity to participate in virtual health education and career development workshops. And once it becomes safe for us to gather in larger gatherings, we hope that students can participate in hands-on activities and group science projects. This would give our youth the opportunity to collaborate with their peers from across the state of Arizona, while also tapping into our resources at the U of A and ASU faculty and students. So the second arm is advocacy. And the CATS advisory board is what we're calling it, will consist of youth from across the state of Arizona. Board members will have the opportunity to serve as advocates in their communities. They also have the opportunity to participate in our research meetings and suggest research questions that may be overlooked by us as adult researchers. Separately, advisory board members will serve as advocates in their respective communities and provide suggestions on how to develop programming or resources for mental health and wellness. And lastly, our last arm is empowerment. And we're hoping to develop a mentorship program. The University of Arizona and Arizona State University graduate students will provide mentorship opportunities for CAT participants. Our mentors will reflect a diverse range of disciplines and different backgrounds as well. And we hope that this mentorship program will serve as a resource for our families and our youth and provide a source of social support for families as they navigate through the pandemic. So we're at the beginning stages of our engagement plan. We're hoping to expand more and do more activities, but this is what we're planning to do so far. So what we've learned three things in the last 3 months. We started our launch in July, and we've learned that we need parent support. So our survey was launched in July 2020, and we initially created 2 methods for communication after receiving parental consent. Parents had the option to either choose to have communication about the survey sent to the child or have communication sent directly to them. And we noticed a very low participant rate among those children that the communication was sent directly to them. So therefore, in September, we discontinued that option. And we realized that parents need to serve as support systems for our youth to get them engaged and to help them participate. So while we want our children to be autonomous and have autonomy, we recognize that parents are very helpful in this process. And then the second thing is expanding our engagement efforts to reach a more diverse audience. Currently, our survey is reaching participants that are part of our sister study, CoVHORT. And for the most part, all the participants have share similar demographics. So as Dimitri stated earlier, in order for us to fully understand the full experience of youth in Arizona, we need to expand our efforts to reach from different backgrounds across Arizona. And then finally, additional personal support and funding. So as you all know, youth research is hard work, and we need people, we need funding, we need resources. So we're hoping that we'll have more of those opportunities so we can have more graduate assistantship opportunities, have more personnel, and have more student interns, and have more funding to support our program materials and all the things that we're planning to do with CAT. So these are the lessons we've learned so far. I know we're short on time, so I'm sure we'll learn more lessons in the next 5 years with this study. So I hand it over back to Demetria, who will talk to you how to enroll in CATS.
Yeah, so first, thank you so much for joining us and for watching our presentation and for engaging with us. This slide has a QR code smack in the center. Please take out your phone and scan it. This is for youth to enroll in our study. So if you have children, you can go ahead and scan that and start the consent process so that when you get home, your child can do the assent process. It's pretty quick and easy. But if you don't have children, if you know people with children, if you know teachers, you can scan it, send it to your networks. And then on the right side of the screen is a clip from our website. And so we're all bridged under the CoVHORT study, which is the adult version of the study. And CoVHORT has been around. They just passed their 1-year anniversary in May, and they have over 7,000 people enrolled already. And we've been out for 3 months, and we're trying to get there. And so one of the main ways that we're recruiting is through that study. Since the adults are already in it, we're asking, would your kids like to participate as well in the youth version of this study? So if you're an adult and you want to participate, you can go onto our website. It is cohort.arizona.edu. And the adult sign up links on there, and then you can navigate to our page if you don't want to do the QR code now to sign up your children and youth that you know. And now I would like to introduce you to our research group, which is an amazing, diverse group of, I could say women, but we just got a new guy on our team. So we're even more diverse now. And we didn't get a chance to add his photo up here though. And we are led by 2 amazing PIs. One is Dr. Velia Nuno, and then the other is Dr. Pamela Garcia. They're on the bottom left, and then in the middle in the red top. And now we have a few minutes left for questions or discussion points, recommendations, or expertise that you all have. We're happy to hear it and discuss it. Does anybody have any questions?
And you can go ahead and drop your question on the chat and I can read it to the presenters, or you can unmute yourself and you can ask the question.
Also, there's an evaluation link in the chat, and please fill that out for AZHEC, and so we can know how we can improve as well. I see thank yous in the chat. Thank you all for joining and participating.
Thank you. Thank you so much. Guess if there's no questions, we want to say thank you again for joining us today and join CATS.
Thanks everyone for joining. We'll stay here until the next session starts. So you can stay here and turn on your camera and network and talk about the topic that we discussed today. So feel free to stay here, or you can leave the room and join your next session, or you can also visit the virtual poster session. So you have 3 options. But thanks again everyone for joining. Make sure you complete the presentation evaluation link. That's going to help the planning committee make the conference better for the upcoming years. Thanks everyone.